On this week's 51%, millions of women around the world enter menopause each year. So why do we know so little about it? We sit down with menopause specialist Dr. Heather Hirsch to learn how you can meet your symptoms head-on by unlocking your menopause type and finding a treatment plan that works best for you.
Not all women experience menopause the same way, and it really has these huge ripple effects into society, into families, into the workplace.
I'm Jessie King. It's all up next on 51%.
I was standing around like one of those girls I had seen in a movie. The whole world was a movie back then. I had my sunglasses on, I wanted to be seen without seeing shy Lolita. I wasn't really in it, I didn't really get it.
You're listening to 51%, a WAMC production dedicated to women's issues and experiences. Thanks for tuning in. I'm Jessie King. Menopause is something that just about all women have to navigate at some point in their lives. On average, women in the U.S. hit menopause, aka the end of their menstrual cycles, around age 51, and with it comes a wide range of symptoms that can disrupt both your health and your daily life. But as our guest today will tell us, just because menopause is a natural part of life, that doesn't mean you have to suffer through it. Dr. Heather Hirsch is an OBGYN turned internist who founded the Menopause and Midlife Clinic at Brigham and Women's Hospital, the second largest teaching hospital of Harvard Medical School. Nowadays, she sees patients virtually and treats everything from menopause and low libido to osteoporosis. Her new book with St. Martin's Essentials is called Unlock Your Menopause Type: Personalized Treatments, the Last Word on Hormones, and Remedies That Work. There she lays out 6 ways menopause usually plays out and even offers a quiz so women can identify what type they are and how they can address it. That said, Hirsch says there's no one-size-fits-all solution when it comes to menopause. Every woman's experience is different. And there's a lot that's still unknown or misunderstood when it comes to midlife care. With so few specialists and conflicting studies on treatments, Hirsch says it's super important to speak with a doctor you trust and to come up with a plan that works best for you. Her goal is to help women be as informed as possible. So let's get into our conversation with Dr. Hirsch.
When we think of women's health, we really think about it in terms of, I want to get pregnant, I don't want to get pregnant, or I am pregnant. I think the most important transition for us as women is actually late reproductive care, because how we treat our bodies in that time really depends on how we're going to age, what chronic diseases we may or may not develop. And so much of chronic disease is really inherently tied into when we lose our hormones in midlife and at menopause. And so actually now as an internist with this women's health focus, I just became obsessed with how fascinating it was to treat women, learn from women, hear women's stories, and help them thrive again in midlife and menopause, that I never turned back.
I guess just chalk it up to my age, or maybe I just heard little about menopause growing up, but I had always thought of it like, okay, maybe your period stops and you'll get hot flashes and things like that, but that's it. It was only really in recent years that I started to realize just how massive of a transition menopause is. So just to start off, maybe we should talk about what is happening to our bodies here. What do I have to look forward to?
Exactly. And I was the exact same way. Again, even as a clinician, as a women's health focused doctor and resident in training, I also really knew nothing about menopause. And so as you start to learn about it, it becomes a lot more fascinating because there's so many different facets to it. If we think about the biopsychosocial model, which incorporates the biology and also some of the psychology and the environment, women going through menopause on average, but not all women, are in their late 40s to early 50s. And it's a time when we're really usually at the peak of our career or everything that we have really worked for, the big promotion. We've done all this work on social emotional intelligence. We may have raised children. We may now have sick and elderly parents. We have houses and spouses and pets and cars and all these things to take care of. And at the same time, our body can start to really change. I was going to say fail us, but that sounded a little too grim. And so symptoms can be very, very vast. And I think that's exactly to your point. We think of hot flashes. We think about Samantha Jones in Sex and the City too, fanning herself, trying to stop hot flashes. But it can be so much more than that. certainly most women do experience hot flashes, but it can really start with a change in mood, new anxiety, trouble sleeping, trouble staying asleep, trouble concentrating, joint aches and pains that all of a sudden affect your ability to exercise or do your favorite stress relievers. It can be, irritability, snapping at your partner, snapping at your children, snapping at coworkers. That inability to focus can change your productivity at work. It can change so many aspects of your life right when you really need to have your stuff together. Because we don't know a lot about how our body changes, because we don't know a lot about these symptoms other than hot flashes, it can just, all of a sudden you can feel really, railroaded or like blindsided by these changes in our body. And it really is like puberty in reverse. And we probably have all blocked out puberty. But if there's that one memory, it's certainly this like confusion over what was happening to our body and why were we feeling all of these new feelings mixed in with being like a middle schooler. It is almost like the same thing, only now you're an adult.
Now, I think it's good to point out that perimenopause and menopause are different things. Can you just go over those terms for me and how they're different?
Exactly. So I actually, even myself, I will interchange these words a lot, but asking what the definition is actually really important. So perimenopause, as you accurately said, is a time leading up to your last period. Menopause is really when you've had no periods in the last 12 months. So no period for a full year. You can say, aha, today it is menopause. And then after you've had a year of no periods, you are postmenopausal, and then you are always postmenopausal. So a lot of times we'll say the word transition or perimenopausal transition or menopause transition to kind of be this broad umbrella of the entire transition. But perimenopause is usually when women are still making some hormones and still having some periods, but symptoms are starting. Menopause is the year of when it's been a year of no periods. And then postmenopausally is once you're menopausal, you're always menopausal.
Now, you mentioned that, this starts usually like in your 40s or 50s. What are the factors that determine how early you end up starting menopause? I've always heard that like if your period starts early, then it'll end earlier.
So that's not always accurate. That's not always true. Although a lot of people think that. Some of it is genetics. So good old genetics. And that means really, truly without a crystal ball, we really have no good way of knowing. And one of the things I would love to see in my lifetime is more precision medicine, when we could say, oh, your period is going to, menopause will be this year and your symptoms will be these and it will last for this long. And that would be fantastic, because right now we just kind of have to guess, take our best guess. So genetics can be helpful. Sometimes it's helpful to ask for your mom's history or auntie's histories to kind of see when menopause was. Environment can play a role. So certain harsh chemicals, especially smoking or heavy alcohol or drug use, that can put you into menopause on average 1 to 2 years earlier. And actually, this is important because there's studies to show the later your menopause is, the longer you tend to live. So actually having menopause earlier doesn't necessarily mean immediately your lifespan's cut short, but it is another clue to your overall health. And then there are also some other medical conditions. So it could be surgery, for example. If we take both of your ovaries out, that's considered surgical menopause. And that could be to reduce your risk of cancer, a known cancer, sometimes things like endometriosis or ovarian cysts. So cancer could be a reason. Chemotherapy could also put your ovaries right into retirement pretty early. Sometimes medications used for endometriosis, like Lupron, is also going to put you into early menopause. So that's another big category, would be a medical indication for early menopause. And then there are some women who experience menopause early. In my book, I call this the premature menopause type. And premature ovarian insufficiency affects about 1 to 5% of the population, where women will have menopause before age 40. And we think that's an autoimmune condition, although we're not entirely sure if there's not other genetic reasons for premature ovarian insufficiency. So there are definitely some known and then some unknown factors as to what could put women into menopause earlier than their predetermined fate.
I'm glad you brought up your book because you do have a new book coming out about unlocking your menopause type. I'm sorry, the exact title is Unlock Your Menopause Type. Let's go into some of those types, I guess. Like, what are some of the different types? I know you mentioned premature, but some of the other ones, and what makes them different from each other? What should people know about them?
Yeah, I'm glad you asked because one of the types is the mind-altering menopause type. And you asked quite early on, about these symptoms that we're not used to hearing about. We're certainly used to hearing about hot flashes. But there's a subset of women for whom I find mood primarily is affected by the loss of hormones and by menopause. And so I dubbed that the mind-altering menopause type. And the reason this is so important and the reason your show is so important is because women are often, unfortunately, treated as men. And that really means that you would think that in medical schools and residency training, we discuss how these hormonal shifts affect chronic diseases or even mental health, but we don't, unfortunately. And so I've seen so many women with mood disruptions, be it new anxiety, severe depression, ADHD, brain fog, cognition, women retiring early, leaving the workforce earlier, and getting misdiagnosed with whether it's bipolar, schizophrenia, a major depressive episode. And it really could be, or in addition, could be menopause. One of the things I hope my book really does shed light on is that not all women experience menopause the same way. And it really has these huge ripple effects into society, into families, into the workplace. The other menopause type that I find really interesting is actually the silent menopause type, which is totally a 180 from even thinking about the typical hot flashes, is a woman who has really no symptoms of menopause. And the reason I wanted to bring light to this type in my book is because even if a woman doesn't have outward feelings or symptoms like hot flashes or dryness or night sweats, our bodies still change significantly with the impact of losing our hormones. And so it affects our bones very significantly. It impacts our brain health. It definitely impacts our cardiovascular health. And so women who have no outward symptoms, yes, they're quite lucky, but they still have to consider that their body's still changing, their risk for chronic diseases is changing. And it's so important that we include menopause so deeply in our conversations as we get into our 40s and 50s so that we do set ourselves up for a wonderful, many, many plus decades of our lives. And it's really my opinion and why I am so passionate about midlife and menopause is that when we don't include this huge physiologic impact and we brush it under the rug and women are treated like men, we're going to miss so many important opportunities to intervene to really improve the lives of women.
This might be a little bit of a side note, but speaking, I guess, of the different ways menopause can be overlooked or women can be treated like men or treated differently from men, I once spoke with a doctor who said that the loss of estrogen can cause muscle changes in your throat, your airway, and that puts women at a risk of obstructional sleep apnea as they get older, and that could be a risk factor for dementia. But women are less likely than men to get screened for sleep apnea. So I guess it just reminded me of something like that. Like, does that sound right to you, that menopause can change the body in that way and have that ripple effect?
It's a perfect example. You could easily think sleep apnea has no connection to menopause, right? But you're kind of now sort of like, I'm putting these together. And you're absolutely right. There's so many links like that. As we go through menopause, our body really changes, fat redistributes, and we are more prone to chronic diseases. And that certainly includes sleep apnea. Bingo. And then why are more men, right, diagnosed than women? It could be because now there's a lot of other reasons. When women go to the doctor, there's a lot more things they have. There's a lot more questions. There's a lot more history they have. So our doctor's not getting to it. Our doctor's not wanting to offend women because sometimes sleep apnea is associated with weight gain. Are women busy because they're not getting to the doctor because they're taking care of everyone to get these accurate diagnoses? And then through that domino effect, could that be one reason why dementia is much more common in women than men, there you go. It's not actually a really far stretch to see that when we don't think about the huge hormonal impact that is menopause, we're missing a huge link to the development of chronic diseases.
We're speaking with Dr. Heather Hirsch, author of Unlock Your Menopause Type. Let's talk about menopause care and treatment then. If your symptoms are interfering in your life or putting you at risk of other things, what options do you have? And I guess this is where hormone replacement therapy, or HRT, comes into play. But I know that can sometimes make women nervous, at least the women in my life. There's been studies trying to link HRT to things like breast cancer. So what exactly is the history and risk there?
So this is a fantastic question. And truly, it's really individualized. But on my platforms, I do talk about hormone replacement therapy very, very commonly. And the reason that I do so is not because it's a one size fits all, and it's not because that's the only option or you're doomed if you can't or don't want to take hormone therapy, but it's because there are still so many myths and misconceptions about the safety and the efficacy of FDA-approved hormone therapy. So I do talk about it all the time. So if I were to kind of summarize, if I could, what's happened to the swinging pendulum of hormone replacement therapy in the last, 20, 30 years, is really in the 80s and 90s, hormone therapy was the gold standard for actually even all women going through menopause. And at one point, 57 to 65% of women were on hormone replacement therapy. Then the Women's Health Study, which was a really, really large randomized controlled trial run by the NIH, ended abruptly in the early 2000s. And this is the study that unfortunately really scared both patients and physicians from prescribing HRT due to an apparent increased risk of breast cancer and cardiovascular disease. Now, this has actually been debunked. Not that the Women's Health Study was wrong or bad, because a lot of people will say that. It's just that when the results first came out in the early 2000s, there was many data points that were not looked at, and they were now been looked at really, really carefully. What we see from the Women's Health Study and many, many, many other studies since then is that when women take hormone replacement, which is an estrogen, a low dose estrogen, plus a progesterone if they have a uterus, within 10 years from their last period, who have symptoms of hot flashes, night sweats, vaginal dryness, bone loss, that hormone replacement therapy eradicates their symptoms, keeps them living longer, keeps them away from chronic diseases like heart disease, bone loss, and diabetes. And these women tend to do extremely well. And there's been many, many changes in the formulations and first-line prescribing practices of hormone therapy. So now a lot of clinicians, myself included, do a lot of transdermal estradiol that is FDA approved, because that's really important, and different formulations of progesterone like Prometrium that really have a very, very nice safety profile. So many women are good candidates for hormone replacement therapy. And the latest data shows that about 5 to 7%, it could be a smidge higher since after the pandemic, but about 5 to 7% of women are on hormone replacement therapy. And when you think about how big that drop is still, I would love to see in my lifetime if that goes up to, 20%, 25%, 30%, because I truly believe the biggest reason a lot of women are not on hormone therapy is because they never have a consult with a knowledgeable physician to really walk them through the myths and the benefits of hormone replacement therapy. And again, I'm really very much an advocate for FDA-approved hormone therapy that's been well studied. And we really, really know these safety profiles and these risks.
It sounds like something to really talk about with a doctor and personalize to your situation then. Does that thinking also apply when it comes to concerns about dementia? Because I know at least one of those studies in the early 2000s tied it to an increased risk of dementia too. But others have disputed that. I mean, you go on the internet and you find any combination of things.
You're right. I will have patients come to me, all different types of jobs, from fast food to CEOs, and they'll say, I've been on the internet going in circles, Heather. And I'll say, I know, because there's so many nuances to some of these studies. For example, the study that showed an increased risk of dementia was in women who were on HRT starting at age 65. But if you kind of don't read the fine print, or this idea of starting early on and the different physiology of the different benefits that has, like let's say your last period was 50 and you start HRT at 51, is so different than if you were 65 and you were a 15-year gap between starting it. So there's so many nuances. And there's not a plethora of menopause doctors out there, right? There's like some, but it's not like there's the same amount as menopause experts as there are cardiologists. And so we're trying to interpret these studies in real time for people, but these media and blog posts that really can make women feel fearful, they're still out there. And they're so hard to constantly, kind of combat or at least explain. And so that's why I do talk about it so much. Now, on the flip side, in 2023, a novel new non-hormonal medication came out on the market to treat hot flashes. And that's really exciting because it's wonderful to have more things in the toolbox. So if a woman says, I still just, I'm not ready for that, or I know I just don't want to, I always want to respect what my patients feel is best for their body because they know their body the best. And it's wonderful now that we do have a few more tools in the toolkit. So this new medication works on the hypothalamus to reduce our core body temperature. How cool is that?
Now, aside from that, maybe if you're not comfortable, if you don't want to go the HRT route, if you don't want to go the medication route, what are the other things you can do to mitigate menopause symptoms and, feel your best?
Yeah, there's definitely a fair amount of things. And I talk about these too in my book, and I kind of break up, different types of diet, exercise, headspace exercises based on your menopause type. Research shows that one of the best things is cognitive behavioral therapy or even self-hypnosis, which sounds kind of silly. But there's a great app called the Evia app that I had seen and used, and it's actually a way to even almost do self-hypnosis, but it's really a way when you feel a symptom coming on, how you can best regulate your body, your feelings, your emotions to tamper down that symptom so that you can get through it and then carry on with all the important things that you're doing. So cognitive behavioral therapy and self-hypnosis, while they seem kind of out there, actually is sometimes really nothing more than meditating or a mindfulness practice or a gratitude practice or journaling. We know that foods that are rich in phytoestrogens and soy isoflavones, which is typically what you would eat in a plant-based diet, can be really helpful in reducing hot flashes. We know that some exercises that can calm the sympathetic nervous system, which is sort of your fight and flight, things like yoga, Tai Chi, Pilates, those can be really helpful in reducing symptoms. But it's great that you asked this because I talked about the mind menopause type where mood is really disturbed. Maybe it's not hot flashes. And this is actually where I actually might say, this is where movement really is medicine. And I might want to have you go out there and, do some boxing or do some a little bit higher intensity exercise. That might really increase your endorphins, your dopamine, your own body's happy neurotransmitters to really, battle some of the symptoms that you're experiencing because of menopause. So there's actually a lot of things that we can do. It's individualized, but more research is, I wouldn't say always coming out, but, there is research coming through a lot of different, there's the Menopause Society, the North American Menopause Society, the International Society for the Study of Women's Sexual Health, and the International Menopause Society, the Endocrine Society. And there are really amazing researchers looking at, not just the medications, but also lifestyle. And my last thing here, just to say is, I see patients and women every day, and sometimes they'll say, I am doing all the things, Dr. Hirsch, I'm eating right, I'm exercising, I'm meditating, I'm journaling, I just can't sleep. And they're really, you shouldn't have to suffer through, because this is at the end of the day, physiologic shift in your body. So if you are still suffering while you're doing all of these lifestyle changes, please talk to your doctor.
That's a good point. And it leads into my last question for you. You mentioned that there aren't a lot of menopause specialists out there compared to like cardiovascular specialists. So how do you go about finding a doctor, and what should you know going into some of those first appointments?
A great place to start is the North American Menopause Society's website, which is menopause.org. And you can actually search by provider by typing in your zip code. Now, one of the things that is really important, I strongly believe, is that you make sure your doctor is still providing FDA-approved hormone replacement therapy. That is the gold standard. That is the evidence-based care. And that's truly where we know, when I talk about hormone replacement therapy, the safety and the efficacy. And so that's another thing you also just want to check and ask the doctors about. You could also call your local or the big academic institution near you and see if they have menopause clinics. Sometimes they do. They're just so new that they're just popping up. And then also ISHWISH, the International Society for the Study of Women's Sexual Health, also has a list of providers who are ISHWISH certified. And these providers often know a great deal about menopause because sexual health is such a big part of our midlife changing. Those are great places to start. Of course, I see patients and there's some great clinicians actually that you could even find on social media, but it's still a little buyer beware because there can be information overload and it can be the wild, wild west. So if you think about those principles of evidence-based care and shared decision-making, that's really what patients should be looking for.
All right. Well, Dr. Hirsch, thanks so much for taking the time to speak with me. I really appreciate it.
I am so honored and appreciate that you are including this topic. It's a wonderful time in life to be really proactive about your health. And there is a lot of information online, and hopefully you can find a source that you really trust. And I thank you for bringing this topic to light one more time.
Dr. Heather Hirsch is an internist and menopause specialist. She founded the Menopause and Midlife Clinic at Brigham and Women's Hospital, the second largest teaching hospital of Harvard Medical School, and currently serves as the Chief of Clinical Quality at Midi Health. She's got a podcast called Health by Heather Hirsch, and her latest book is called Unlock Your Menopause Type: Personalized Treatments, the Last Word on Hormones and Remedies That Work. You can learn more about her and her work at heatherhirschmd.com. Thanks for listening to this week's 51%. 51% is a national production of WAMC Northeast Public Radio in Albany, New York. It's produced and hosted by me, Jesse King. Our associate producer is Jody Cowan, and our theme is Lolita by the Albany-based artist Girl Blue. Just a reminder that you can listen to 51% anytime at WAMCpodcast.org or wherever you get your podcasts. On social media, we're at WAMC Radio, and you can stay in the loop by signing up for our weekly newsletter, Airwaves, at WAMC.org. We hope you'll join us next week. Until then, I'm Jesse King, 51%.
I was every single girl, I was nobody else, I was so sure of myself. I was 15 and a half, he was a hollow laugh. And I lost my cool somewhere along the way. At night, down the hallway, I had to learn how to look away. I lost my cool.